Hello, hello, hello. This is Steve with the Expose Healthcare YouTube channel. So I released a video yesterday, got some good feedback about uh, anti-vaxxers. The article was in defense of anti-vaxxers. This one is going to be about physician burnout. Happy doctors equals happy patients. Wrote this about a year ago as well. And once again, I'm going to basically read this article, which it's published on LinkedIn. It's a newsletter that I have there called the Exposed Healthcare Newsletter, LinkedIn. You could follow it there. So I'm just going to read through it and then give my 2 cents to what I wrote a year ago as I go through it. So during my research regarding physician burnout, I came across the same problem over and over again. Doctors are too afraid to comment on burnout because they are afraid of getting fired. One doctor who chose to be anonymous explained, physicians often have difficulty achieving work-life balance. To be a dedicated clinician, it often requires spending additional time with patients. The commitment to being an excellent physician is difficult to balance with the demand of being a devoted parent or spouse, which requires spending more time at home with the family and kids. This is made even more challenging by administrative and non clinical demands placed on physicians, taking precious time away from both patient care and their families. So, some thought over the past year has to do with AI and how ChatGPT and other large language models could help with this administrative and non-clinical demands, and even some of the clinical stuff. So this doctor that I remember speaking with, I remember showing at some point how ChatGPT could help him with administrative stuff, filling out different soap notes and whatever. And he was like blown away because what normally he would have to spend a lot of time and repetitive tasks, he'd be able to do very quickly through AI. And even clinical stuff, um, getting different dosing for medications, for medical procedure, figuring out a weird situation, what to do about it, and using clinical data. So just want to put my 2 cents on that. For this article, I was able to interview Olivia Morris, who co-founded Doctors of Living with her husband David, a physician. Olivia explained that doctors are expected to continue without complaint and rise above the issues they are experiencing. So they're trying to solve the problem of physician burnout in Ireland. This Doctors Living, Olivia Morris and her husband. They're trying to solve it in Ireland. They're trying to solve it in the UK and even in the US. And I asked Olivia how this idea came about, and she said her husband was working long hours, heavily burdened by medical school debt. He nearly crashed multiple times driving home as he was falling asleep. He missed every event, and we never went out anymore because our plans would always get canceled. He went from being this hugely passionate, dedicated, and warm physician to somebody who had no energy to form a sentence. And this is something that I've seen with a lot of doctors, friends that are doctors, work crazy hours in service of their patients. But can you truly serve your patients well if you're totally like burnt out and you can't even speak? I don't think so. So this is a story I've heard over and over again for physicians I've befriended over the years of being a pharmacist. Olivia stated in the UK and Ireland, the problems often heard is short staffing, bullying, underfunded hospitals, lack of support, long working hours, and abuse. The system is funded mainly from the government. Patients tend to take advantage of this, and there's a lack of respect given to physicians overall. Their pay is often a second thought, too. This leads to financial struggles and adds stress to their lives, but when they speak out, they are classed as greedy because people assume they are all rich. So in America, I don't think most doctors don't have that problem. The finances, a lot of most doctors make at least 200, 300,000 unless they're in primary care. And even then they're making like 150, 200,000. So in America, it's not that much of the financial situation. It's more of the stress. Unfortunately, she explains that in the U.S. it is even worse. They work longer hours on average than those in the UK and Ireland. They are expected to be alert and giving their all, even though they are probably working for the 80th or 100th hour that week. They are mentally and physically exhausted, and during rotation could have to move extremely far away from where they were, thus giving them instability and lack of any social life to keep them balanced. They have more risk of being sued. They have more paperwork as they manage their accounts, insurance companies. Despite their differences, the problem remained the same: long hours, no breaks, no support, exhausted, and lonely. So, yeah, I mean, are they making more money in America? Sure, but is it worth it? I don't think so. It's crazy. Since this is depressing, let's get to the point where Doctors Living is trying to save a group of people that is too busy saving other people. So, Doctors Living that work with individual doctors and their families, but also with organizations that employ physicians. They also raise awareness and advocate for change with policymakers to promote healthy practices for physicians. On an individual level, they have free support groups, a free life check questionnaire, and free 15-minute calls for guidance. If a physician needs more assistance, they do offer paid services for ongoing life coaching. Finally, they are launching a podcast, which would be a convenient and free way for physicians and their families to digest some useful tips to de stress during their commute or lunch break. One of the biggest struggles that doctors have is feeling they are alone. So, Doctors Living has made it possible for physicians and their families to feel like they're part of a community. Knowing you're not alone can sometimes be the best medicine for physician burnout. Um, so yeah, my thought to that is from a year ago writing this is it's definitely good to feel like you're part of something, but I think it's also part of a community, but I think it's also empowering to do something about it when you're suffering uh, from just like regular depression, anxiety, or any other issues, and you are doing it all on your own. It's very difficult. But when you reach out to your support network, hopefully a good group of friends, family, psychiatrist, uh, you feel empowered to do something about it. People can offer their advice. So, in one of their consultations with a physician, Olivia spent a day hiking with their client and used nature to center him, to help him find who he is and take him away from any distractions. We walked and talked, and after a lot of thought and discussions, he realized he was lacking social connection and had forgotten his purpose. That's beautiful. Um, that's really beautiful if you think about it. What a great service. If you're an administrator or company that employs physicians, Doctors Living can provide the following consulting services to improve the well being of your physicians. We assess, analyze, speak with physicians, look at their environment, speak with management teams, and then provide feedback and solution based advice on how to make appropriate and sustainable change. This would not only make your employees happier, but will improve patient care because happy doctors make happy patients. This is something for pharmacy. I could see this being a great service for the companies like CVS, Walgreens, any large chain, and even smaller chains. Uh, from personal experience, I know other pharmacists have suffered a lot through burnout, the biggest chains of Walgreens, CVS, but also small mom and pop pharmacies because there's just so much on your plate. If there was a way for the company to basically give the employees this channel to speak to someone, I mean that could be pretty amazing. Plus the feedback loop, uh, you know. So imagine like a company like CVS enrolling their different pharmacists in this program to speak with people, and then they get feedback of what's really causing the burnout. It's not always as simple as not enough tech hours, which is a very common complaint. For me personally, the reason I left CVS is because of the software. The software was just horrible, and I didn't feel even like safe dispensing medication because it was just like so glitchy. How do you know what you're dispensing if it's you could be dispensing a completely different medication by accident? Um, so I asked Olivia what she would like to expose about the healthcare system, and she wants physicians not to accept being burned out. Furthermore, she stated, administrators, policymakers, and management teams need to listen to these physicians when they say they're struggling and need help. They must take action instead of just talk. This was a touching interview because as a pharmacist, I struggled with anxiety, depression, and unfortunately, even a bout of suicidal ideation. So, how can our healthcare providers take care of us when they are not being taken care of ourselves. You know, um, like I said, this is definitely very applicable to not only doctors, but pharmacists, nurses, pretty much everybody in healthcare, perhaps even beyond healthcare, um, especially in the New York area or metropolitan areas of the world. You're going to have a lot of, pressure to work. So, I hope you enjoyed or not enjoyed. I hope this was enlightening. It's a little bit depressing to enjoy. I hope this was enlightening. If you have any comments on it, please comment down below. Please subscribe down below. The whole bell thing. Ding. Subscribe, like the video, share this with doctors, nurses, pharmacists that you know. You never know if they're suffering from burnout. So a lot of them are able to hide it very well, like most people do. But they could be suffering inside. And hopefully they check out Doctors Living and if they need it. All right. Thanks, everybody. Peace.